You are in bed and you hear your partner stop breathing. And you wait and wait for them to start breathing again, but silence. And just as you're about to nudge them, they gasp and start breathing again. And this happens several times during the night. Or perhaps your partner snores so loudly that you're unable to share a room together anymore. They snore so loudly that the whole house vibrates. These may be symptoms of obstructive sleep apnea. Hello everyone, my name is Dr. Adeze Ifezulike. I'm a family physician and a lifestyle medicine physician. Following my last video on sleep, I got a request from one of my subscribers to do a clip on sleep apnea. Have you watched my video on how to sleep better? In that video, I gave you 20 tips and hints to help you with better sleep. So please go and watch it. I believe it will help you. So I'm doing this clip in response to this request on explaining sleep apnea. So let's look at it together. Have a look. Okay, does this resonate with you? Have you come across cases where you felt, oh my goodness, I suddenly stopped breathing in the sleep, or I felt I couldn't wake up, or masquerades are chasing me, or one thing or the other? It's quite a common happening, and it scares people. And oftentimes people just assume it's nothing to worry about, just part of life or something that happened during the day that's playing in their sleep. But it could be a sign of sleep apnea. Okay, so what is sleep apnea? Sleep apnea is a common sleep disorder where your breathing stops frequently during sleep. So the most frequent type is obstructive sleep apnea, and it's caused by blockage of the airways when your throat muscles relax during sleep. The space behind your tongue narrows as the muscles around there become relaxed in sleep. So that's normal, but the problem is when this narrowing is more than usual. That will result in a partial obstruction of the airway, causing you to snore. So that snoring is because your airway is partially obstructed, okay? However, sometimes that relaxation goes too far. Your tongue relaxes so much when you're sleeping, the airway muscles relax, that you actually have complete obstruction of the flow of air. That's obstructive sleep apnea, okay? Apnea means no breath. It means you're not breathing. So this is usually commoner if you're obese, as the fat narrows the walls of the pharynx and the airway. That area, your airway, is narrowed by the fat. Or you might have a jaw that is retracted. Your jaw is sort of receded back or is small, narrowing the airways as well. And some people find that with age, the muscle tone around their neck is less. Or you might have such large tonsils that is actually narrowing your airways. So what are your symptoms? You might have symptoms like loud snoring. Do you know that person who snores so loudly the whole house can hear them? They may actually have obstructive sleep apnea. So it might be that that's what they're experiencing. And instead of being upset about their snoring, might really need to get them checked out. Or you might be gasping for air during sleep. You might find that during the day, you feel excessively tired even though you've been sleeping, or you feel sleepy during the day, or you're waking up with morning headaches, or you find that you can't even concentrate, your concentration is impaired, or you're irritable during the day. During the day, you just feel unsettled, your body is just not right because you're not sleeping well at night. These may be symptoms of sleep apnea. Sleep apnea is not a harmless situation. It's not just that you're making noise, you're snoring and disturbing people around you. If untreated, it can actually lead to serious health issues like high blood pressure, heart disease, arrhythmias, or arrhythmias are irregular beatings of the heart, okay? Or strokes, or even diabetes. So there are lots of risk factors, things like smoking. If you're a smoker, I encourage you to stop. If you're overweight, you're at risk of sleep apneas. As one gets older, the muscles generally aren't as efficient as before, so that may also happen. Or you might have a family history of obstructive sleep apnea. So how do we diagnose this? Now you've heard the symptoms, you're beginning to feel, oh, maybe that's what I have or that's what my partner has. What do you need to do? Really important to have a sleep study. Get in touch with your doctor and be referred for sleep studies, okay? Sleep studies are super important. I don't think people know enough about them. They really help the doctor to understand what is happening to you when you are sleeping. It can detect things like obstructive sleep apnea, narcolepsy, hypersomnia, and other sort of sleep disorders. So what happens during the procedure? A trained person will attach electrodes to your head, and through it they can monitor your sleep stages, your heart rhythm, your breathing, your oxygen levels, any limb movements if you're thrashing about in your sleep, or your muscle tone. So they can detect all that from a sleep study. So the technician doing the sleep study will be in another room, but they can see you on the screen, okay? So they can see the data, all the tracings and so on about what's happening to you. They can see if you stop breathing, that's you're having apneas, that's pauses in your breathing. If you're having apneas, they can see that on the screen, okay? So really important, I can't emphasize that enough. If you're having symptoms suggestive of obstructive sleep apnea, please do all you can to get a sleep study. Okay. So what are your treatment options? Number one is lifestyle. Lifestyle is the game changer in a lot of medical conditions. And I'm a lifestyle physician, so I'm telling you that if you make changes in your lifestyle, that may be all you need to treat your obstructive sleep apnea. Lose weight, stop smoking. Other people find that when it's worse, their sleep apnea is worse when they lie on their back because their tongue falls backwards and blocks their airway. So you might try sleeping on your side, on one side or the other. Avoid substances that can make you sleepy, like alcohol. Alcohol is bad for obstructive sleep apnea. You see, a lot of our men take beer, alcoholic drinks in the evening to relax. It may actually be making your sleep apnea worse. So consider stopping alcohol or cutting right back on the amount you take. The other thing to avoid is sleeping tablets because they already make things more relaxed and can worsen your obstructive sleep apnea. Okay. Some people try a mouth guard. A mouth guard sort of pulls your jaw forward and your tongue forward to improve your airway so it's not blocked. However, the most effective treatment is a CPAP machine. I don't know if you've heard about CPAP machine. CPAP stands for continuous positive airway pressure. Okay, so this machine applies a mild pressure with air that helps to keep your airways open. So it's like keeping the airway open with a mild pressure. Okay, it may not cure your sleep apnea, but it will help your brain to get more oxygen, which is crucial for health. Because when you're having that apnea, you're not getting any oxygen into your system. Okay, some people suggest exercises to help strengthen the area around your throat and the back of your tongue, such as singing. Some people say push your tongue upwards, up the roof of your mouth, and keep it there for some minutes, bring it back down, push on the lower bit in the floor of the mouth, and so on. They may or may not be effective. You might want to try them. And other maneuvers, someone suggested coiling your tongue. So do you know how to coil your tongue? I had to learn this because I've never been able to do it, but I've now managed. I'm one of those who can easily coil their tongue. This took me a long time to learn. Now, back to what we're saying. So these exercises may not be super effective, but they may be worth trying. Okay. So obstructive sleep apnea is not a harmless condition. It's not just a nuisance that disturbs your partner. It's actually a very serious condition. And we must not neglect it. When we hear someone went to bed, they just died from there, or that sort of thing, we have to look at what might be causing that. And we know that sleep apnea might be contributing, okay? During apnea, you're not getting any oxygen, and it's a major strain on your organs, including your brain. So managing your sleep apnea will improve your sleep, it will improve your overall health, and it will reduce your risk of complications. It also means that your spouse can sleep better too. So it's essential for you to seek medical advice if you suspect you have sleep apnea, and do all you can to get a sleep study that may be able to tell what exactly is happening when you're sleeping. So I hope this has been useful. let's not be thinking that some demons are chasing us when we're sleeping or we're falling off a cliff or all those symptoms. It might just be the sign that your brain isn't getting enough oxygen, so it's bringing up all these images to you. Okay, hope this has been useful, and I hope to see you back on my next video. Remember to drop any questions in the chat, share the video. If you have any questions, and drop it in the chat, I will have a look and try and do a video response to answer your questions. All right, so thank you so much for being with me. See you next time. Please subscribe if you haven't. Like the video, comment and share it. Thank you very much. See you next time. Bye.